Greetings, brothers and sisters, and welcome to our study today, Sabbath, the 23rd of August, 2025, where we are looking at our study entitled Pregnancy and Midwifery by Brother Keagan Banda. So at this time, we hand it over to Brother Keagan for the prayer thought and the opening prayer.
The reading is coming from Ezekiel 16, verse 1 to 4. Okay. So then, beginning to read Ezekiel 16, verse 1, it says, "Again the word of the Lord came unto me, saying," that is Jerusalem's sins described by God. Okay. So again the word of the Lord came unto me, saying, "Son of man, cause Jerusalem to know her abominations. Son of man, cause Jerusalem to know her abominations. And say, Thus saith the Lord God unto Jerusalem, Thy birth and thy nativity is of the land of Canaan, and thy father was an Amorite, and thy mother an Hittite. And as for thy nativity, in the day thou wast born, thy navel was not cut, neither was thou washed in water to support thee. Thou wast not sorted at all, nor swaddled at all." Okay, this is the reading. So this one is describing how uncared for Jerusalem was until God came to care for Jerusalem. So with this, we can pray. Our Father, which art in heaven, we thank you for today, Sabbath, that to you, O Lord, the relationship that you have with us is like us were your adopted children, that you have come to care for us, to nurture us, to make us grow in the admonition and fear of you, so that one day we'll be glorified, we'll receive the righteousness of your Son, Jesus Christ of Nazareth, so that we'll have immortal life. O Jesus Christ of Nazareth, may you teach us the lessons that pertain our lives today. We're looking at midwifery. May you help us to understand. Perhaps we may advance in that of the children of an infant. May you help us to grasp that which you have revealed through your prophetess and the Bible. We thank you. May you open our brain cells to comprehend. In the name of Jesus, we do pray with thanksgiving in our hearts. Amen. So I gave an assignment to look at lotus birth. I don't know who did. Do you look at it, Brother Piri? Okay. So those who are looking at, I don't know if you've been following the audios. Have you been following the audios? Okay. We're looking at midwifery. You know what midwifery is? Okay. So in this study, we learned saying midwife is a person who helps to deliver babies. You understand? That's a midwife. So in the Bible, all midwives were females. But today's practice today, we see that the midwives can be a male person, which is against principle and ethics. Because if you become a midwife as a male person, then you help to deliver babies. You'll be seeing someone's nakedness. You see, now? So meaning if you see someone's nakedness, you violate the rules allow in our practice of midwife, we should not allow a male person to become a midwife. That is what we learned in this lesson. Okay. So meaning that if we present with believers, we embrace the truth of midwife, we should train ourselves to be midwives, especially the females to be midwives. If a male is learning midwifery, it means he has to deliver the child, his child. Just like the examples of Joseph, who delivered baby Jesus, was it Joseph, the husband of who? Of Mary. So it's okay to see your wife's nakedness, but it's not okay to see someone's nakedness. Okay. So that's the reason council has warned us time and again to avoid temptation, not to make males to be delivering babies, other people's babies. Okay. It's not only delivering babies, but also other practices which involves to see the nakedness. For instance, the radiographer demands you to see some nakedness. For instance, if you're doing screening, okay, vaginal screening and other body parts. So there are those things which or you want to do to check if someone has or putting what do you call catheters. It require you to put through the urethra. So you see someone's nakedness. When patients are sick and they need to be put catheters and many more other conditions. So that is what we looked at. Those are one of the points that we looked at. And from this also we learned saying the delivery process and how to deliver babies. So where we ended, we looked at the process of delivering babies. Then we came across what you call lotus birth. In lotus birth, you know, the normal delivery or the common delivery that people do is that once the child is being delivered, they cut the umbilical cord. That is the normal one, or the thing that we are familiar with. Then in lotus birth, they don't cut the umbilical cord. Okay, they don't cut the umbilical cord. So that's what we came across. So we gave an assignment saying that we should look at lotus birth. Okay. Sister Olivia, did you look at lotus birth? Okay. So the reason being, when you looked at the reason why we came across lotus birth versus delayed clamping is because in medicine, they've adopted delayed cord clamping. The reason why they have adopted this delayed cord clamping was that they discovered saying that the more they delayed to cut the umbilical cord was more beneficial to the baby. Okay, because that placenta acts like what you call roots, where the child gets its nutrients from and blood. So they discovered that if they keep that umbilical cord, placenta connected to the navel of the babe without clamping the umbilical cord, they noticed that more blood was benefiting to the baby. So the reasoning was that in case there's still blood in that placenta, the child would get through the umbilical cord the blood from the placenta into the baby, and some nutrients from the placenta into the baby. Okay, that's the reason they began to practice today delayed cord clamping. Delayed cord clamping. So meaning that when you look at it, because then when you compare it with other animals, the other animals, they cut their umbilical. They cut the umbilical cord once they give birth, like the apes and the carnivorous animals, like cats, dogs. Once they deliver the dogs, the puppies, they deliver puppies, they will cut the umbilical cord and eat, and they eat their water. Their placenta. Yes, they eat. Likewise, the cats. But when they viewed the chimpanzees, what they do is that once they deliver the babe, they will not cut the umbilical cord. Chimpanzees, they don't cut the umbilical cord. And they are the ones who practice what they call lotus birth, chimpanzees. Okay, so let us look at it. So lotus birth in humans. Lotus birth is the umbilical cord non-severus, meaning the umbilical cord is not cut, non-severance, inspired by chimpanzee behavior. Claire Lotus, she is the one who inspired this. That's the reason it's called lotus birth. So this one is named after Claire Lotus. Claire Lotus Day was the first to widely promote the practice of lotus birth. Claire Lotus Day was the first to widely promote the practice of lotus birth in humans in the 1970s. So it's a long time, in 1970s. Okay. The process involves leaving the placenta attached to the baby until the umbilical cord detaches on its own. The process involves leaving the placenta attached to the baby until the umbilical cord detaches on its own, typically within 2 to 10 days. But when you check typically, the reason why they say it's according to someone's menses. You see how long the umbilical cord would detach. Okay. This practice is rooted in the idea of allowing a natural process to unfold without early intervention and is seen by some as a way to foster a stronger connection between the baby and the placenta. Though delaying for an hour or so to cut the umbilical cord is common now, some home birth practice lotus birth. Okay. The one that we looked at, the delaying of cutting or clamping the umbilical cord is common now, but we've seen others, because due to that fact, they've adopted lotus birth. Okay, because if you delay for an hour, then why not leave leave the umbilical cord and uncut for just 4 days or 10 days? Okay. Then the purpose of this is one, they've discovered that once they cut the umbilical cord, they leave shock to the child and the mother. There's what you call, the mothers pass through what you call postpartum depression or shock, which a lot of mothers today, they suffer from. This could lead to what you call eclampsia, that is hypertension after what you call hypertension after delivery, after you've given birth, because of the shock that they receive during that. Okay, because there was a sudden cut, separation from their child, from the child and the mother. Okay, so here the purpose is this, is that transitioning the baby outside the womb without trauma, or without the child being traumatized and the mother from being cut from the mother. Okay, so that is the purpose, to prevent that trauma that the mother experiences and the baby. It's considered spiritual, for the placenta belongs to the baby, not the medical byproduct. Okay, others would do, for instance, especially here in African belief, we see that the placenta is more valuable, because if they want to do rituals, they can use the placenta. Others, they would sell. They'll sell, like the hospitals, we do not know what they do with the placentas. Okay, maybe they sell the placenta, or they make some because they are more valuable, Okay, we don't know what they do with those placentas. Okay, but there have been news where some would buy the placentas. They would buy placentas from the hospitals. Okay, so that placenta does not belong to the hospital, or it is not a byproduct of the medical place or medical institution. These placentas belong to the child and the mother. That's the reason others, they would demand, though they will not practice lotus birth, but they would demand their placenta to be given to them. Okay, whatever they would do, because it is theirs, it doesn't matter. Others, the spiritual significant, others, they would, like in Nigeria, they would get the placenta and they bury it where the waters drop, like the rainwater. So if the others that do the connection of water that comes from the roof, then they have what do you call that pipe? Then the water falls. Huh? I got, okay, the same one. Then they would bury where that water is pouring. Okay. No, they bury it. You know the process when you do that one. That is an organic farming. When you want to make something rot fast, you bury it and you'll be watering. You're increasing, okay? You call it biograding of that product underneath, because the bacteria will be feeding on, you understand? The more you like, you've dug it, you've buried it underneath, then water, I don't know if you've done if you bury, you get manure, then you put it underneath the soil, then you'll be pouring water. If you pour water, it will decompose fast. Yes, but the belief there is saying that you are, what do you call? You are connecting or watering the what? The spiritual significance of the child that is in Nigeria. Okay, basically that. So in short, lotus benefits is that it also connects to the spiritual significance. Okay, spiritual significance. And the olden times, when you check it in the place of the Bible in education, the reason to why education has become number one over spirituality today is because of the lowering standards of the Christian movements. Because olden times, the beliefs, the cultural beliefs, and the spiritual significance or importance were the first ones in the ABs of education. Okay, so if meaning that in the schools of the prophets, the first thing to be learned was to fear God, wisdom. Then number 4 was science, this science that we're learning. But because of what Christianity has done, the Christianity was taken over by science today. So people respect science than what? The fear of the Lord, understand? Than belief or religion. Okay, that's what it has become today, especially during the time of Paul. Okay. You want to say?
Oh, yeah. Maybe just an addition to what Brother Keagan is saying about people respecting science today more than God. We see that that was common with the heathen. It was a common practice for them to consult astrologers, magicians, soothsayers before they go to those who believed in God per se. So you see that when we are told to say the church has turned back from following Christ our leader. And also when we see inspiration saying that daily the church is being converted to the world, that is basically what we are learning. So you've seen like the example we normally give of the COVID pandemic. All of us trusted the scientists. What the Bible didn't change. Look, what is interesting, especially about Zambia, is when we have the time that we say that it is the October 18th, National Day of Prayer. Listen to the quote that we always get from the Bible. If my people shall humble themselves and pray, what happens? I will hear and heal their land. We quote that. But when COVID came, how many of us say if we humble ourselves and pray, God was going to heal the land? You see? So you see that all of us have, like Brother Keagan has put it, we trust humans in the so-called science. We think that what they have proven is correct. In essence, what they are using is the laws of nature have become their God. They have started worshiping the creature instead of the what? The creator. So that is the sad aspect indeed. Thank you.
Yes. We're recording everything. Can you just ask a question?
My question is, according to the same lotus birth, how because the placenta is attached to the umbilical cord of the baby for some days. Now, how do they protect it?
That's what we're going.
Yeah.
Okay. So let us look at the risks. First, before we go to the risks, we go to the benefits. It's asked a question, so let us put in mind the question is asked. The benefits of lotus birth. There is what you call more blood and nourishment to the baby. This one, in a sense, it is ascertained. It's a fact, because the reason why they've adopted delayed what you call clamping. Because the more you delay, the more blood goes to the baby and nourishment. Okay. The number two is that no open wounds means no infection. So meaning if you sever the umbilical cord, there's open wounds. Okay. So there's more infection. These are the benefits they see. Okay. So if there's no open wounds, there's less infection. Then faster healing of the umbilicus. So there's faster healing. These are the benefits. Emotional well-being. The emotions are not tempered with of the child. There is no trauma. Postpartum healing. Okay, it allows the mother to heal. Okay, not depression. Gentle transition of the baby from the womb to the outside world. Okay, you are gently introducing the child who was in the womb to the outside world, not abruptly introducing. Okay, the opposite of gentle is what? Mishandled. Yes, rashly introducing the child into this unborn world, outside world. Decreased injury to the belly button. It also decreases injury to the belly button. Then there's again a spiritual significance. These are the benefits of lotus birth. The risks are these, is that infection. If you mishandled, if you don't, that is the risk, particularly of Staphylococcus infection, which is found in blood. Okay, so how now to take care of this infection? How to take care of not to take care of the infection, of course, to prevent the infection, is to season. These are the points. See, seasoning the placenta with salt. Seasoning the placenta with salt. You get salt, you season it. Then you get essential oil. Some of the essential oils, the one that I have in the pocket. But essential oils you can buy. There's what you call eucalyptus. Eucalyptus is common today. There's again this one. This one is peppermint, but they are selling it under scorpion, the name. I think also tsunami. Tsunami, I don't know what, but I think it's a mix of essential oils which are in it. But this one I managed to recognize the name because I was using a lot of peppermint essential oil. So when I tested this, I recognized that this was peppermint. So to quench the smell, because you want to quench the smell of the what do you call the placenta. You have to put salt and pour essential oils. Understand? Essential oils. Okay. Yes, yes. Then other than yes,
That's why it is able to draw, the child is able to draw blood from it. As it is drawing, then it is getting dry, that's what you do. That's when it becomes exactly dead. Yes. Yeah. So
understand?
yeah, a cell may even if the toss a cell will live, it doesn't mean that it's a dead cell. But if we expose it to certain conditions, it starts to die because it is lacking certain elements that it needs.
Okay. So it dies slowly, in short. Okay.
Okay, the other thing that I wanted to comment on in relation to his question is remember that when the child is born, when he was in the womb, he was connected to the placenta and was receiving nutrients through that connection. And so when he is born and you immediately cut, it's like I'll give it the common thing. It is very hot, then suddenly it is very cold. What happens to a human body? Some get sick, some can collapse, many things can happen, right? Yes, so that is why we're told to say the benefit of not cutting is that you allow the child, as it is being introduced to the outside world, it is still connected and living the connection that is normally normal for that child. So you see that somebody, while is in that normal state that they are in, they are introduced to this, what we would call more like abnormal but adaptable condition. Yes. So you see that is what we are taught to say it's the benefit. And we are taught to say in other cases, if you don't want to leave the placenta with a child, you delay the cutting. So that whilst the baby is outside for a few minutes or so, adapting to the conditions of the outside world, then that child acclimatizes or adapts nicely. So you see that those are some of the benefits. So, I remember, Brother Keagan, you even told us something very important on the part of uh, blood and jaundice. At those that they cut quickly, they come out with different colors. The child will look blue, then yellow, such things. You understand? That is because you did not allow the child to draw the blood from the placenta into itself. So maybe that is what I wanted to add. Thank you.
So I hope I'm answering your question. Huh? Okay. So then they place it in what you call a cotton material. Place it in a cotton material because you'll be carrying the child in that what you call during the time when it is still attached to the placenta. Then prevent pull or tension of the umbilical cord. Pull. Okay, so you have to keep it closer to the child so that you prevent pull or tension closer to the child. But again, at the same time, you have again to prevent the child from playing with the what? Umbilical cord. Because tubana tukabado tumambo severesa, you know, huh? They want to touch things, huh? They can be putting it in the mouth, putting the cord in the mouth. So you have to be cautious of all those things. Okay. Then it naturally falls according to the menses, so to your menses of the mother. So if the menses were taking 7 days, it will fall in day 7. If the menses were taking 4 days, it will fall in day 4. Okay. The what? The umbilical cord, it will naturally fall on its own. So the period of falling is 3 to 10 days short. 3 to 10 days. I think that language is good. So it naturally falls. Yeah. Just like this is the same time that it falls. When you cut it, still more, that umbilical cord, it will fall. And the point of falling is from the navel, just from the navel, that's where it falls from. It doesn't fall from the what? The length of, it falls from the navel. Okay, that's where it falls. Okay. So after it has fallen, other people, they again beliefs attached to that of what to put on the on the navel. But basically salt, you put dry salt on it. Don't be scared, it doesn't pain. Just put dry salt. It will heal very quickly. Dry salt. 1 to 2 days, it will heal very quickly. Thank you. You understood that? Okay. Basically that. Just on the open navel there, on the once it is cut, you get those salt, dry salt, you place it there, you put. Don't follow those things that which they teach. They will tell you saying put stuff. Just the normal salt. It will work. I don't want to mention those things which they say. Okay. So any more questions on the lotus birth?
I want to ask because I've heard some beliefs where they say that when the placenta falls or the umbilical cord falls,
Was
like especially in the male child.
what was it?
Yes. And then the other thing also I want to mention.
No, say it. Say it.
You've already read my mind, so you've taken lot of what I'm trying to ask about. The other thing I also want to say is that the reason why maybe the world has taken charge of the lotus birth coming in place. Maybe it's because the Bible hasn't said much on the delivering. Yes, because in when the remember the maidens, the midwives in Egypt were told just to kill the male children that were born. And then everywhere in the Bible, you see that just the person would conceive and bear a son and name and all that. So most of it was not given, even when Jesus Christ was born after. I just thought to say when he was born, he was taken to Jerusalem and all that. So I think maybe that's the reason why the world has taken charge as in compared to having it taken in the biblical way.
Okay. So what he's saying, he says there's not much information in the Bible on the process of childbirth. So we do not know whether the lotus was the biblical practice, okay, of childbearing, or the normal one that we practice of cutting the umbilical cord after childbirth. We do not know. But what we've discovered so far is that the delayed clamping has benefits. Also, lotus birth, there are people who have done it. It is successful. You can do it and it cannot affect the child. Okay, because also in the normal what do you call cutting, there's again risk of infection. There's also risk of infection of the child. So either way, there's infection, there's risk of infection. Okay. So, and the other one, the question that she's asked, I almost forgot it. Is there are two, actually, there are more beliefs. There's one, the belief of the Fontanelli, you discovered Chapa Mutu. Number two, there is we address that one. There's again the belief of the teeth. There's again the belief of the falling of the umbilical cord. They say if the umbilical cord falls towards the manhood or the manhood of the baby, okay, towards the penis of the baby, meaning the baby will become what do you call infertile. That's the belief. So they make sure that if you're all the male children here, if you ask your mothers how they took care of the umbilical cord, it did not fall towards your manhood. All of them, as long as you're black. Huh? Yes, as long as you're black. That's what they did. They make sure others, what they do is that they get a thread, okay, from here, then they tie here so that they prevent it from falling downward. Me, the stance, I'm not against culture. Most of the cultural practices were correct. So I do not know the significance, but that is culture. There are reasons to why that is done. Okay, I haven't lived old enough to know the reasons, but the reasons what they give is that the child will become what you call infertile. Yes, impotent. Okay, so those are the reasons. We have to follow them. Okay, those are cultural reasons. Even of the teeth, you know the teeth. Ati mwana safunika mera meno yapata ya poya yapa mwamba. Yes. Okay.
When a child is there from the, I mean, when a baby developed teeth from the upper lips, these upper gums, they consider that child to be a very useless child or a wicked person. And actually, they consider them to be either fools or people who do atrocious things or commit atrocities in life. That is what they believed. I don't know with those of us that are keeping them, whether this is part of the reason why we have a lot of such problems. Yes, I remember learning it from my Bemba grandmother that any child that developed teeth from the upper gums, they used to kill or throwing the baby away. And actually, they invoked the presence of the Holy Spirit and other things according to them. Some rituals were performed so that such a birth should not even occur in anyone in the family. That's what they are saying. Okay? But today, people don't care. Yeah, they have stopped caring. So, whether it was true or some myths, I'm not so sure. So, naturally, according to tradition and culture, teeth should develop from the lower gums. Yes, not the upper one.
That would prevent the teeth from growing there. There's a certain powder that they would be rubbing pamwamba, kutuntia made. If they see signs that they want to come out from pamwamba, upper gums, they'll have some medicine to be rubbing there. Okay. Basically that. So the stance. This is my personal stance. I'm not against culture. Most of the cultural standards we should adhere unless they disconnect us from God. Okay, basically that. Yes, brother. Okay. Yes, we discussed that one. The tongue tie. So, but Alphonse is asking about the tongue tie. Yes, the tongue tie is there even in medical. They've adopted it now in medicine. So there's what you call tongue. In medicine, it's called tongue tie. So they are able to do. It's a surgical procedure. Okay, but today, the one that since in the government hospitals, they don't really check the child. Once the child is, the only thing that they check is they'll just check maybe the weight of the child, check the skin, the child is health, and the mother after delivery. Okay, and they do the vitals. Then they forget. They don't check the tongue tie. So the ones that do that, commonly do that, is the traditional people. Okay, they check. There are those that are specialized in African surgery. They are surgeons, African surgeons. I don't know if you know them. They are very good at that. They are very good at cutting the epiglottis. They're very good at cutting these. They're very good at cutting tunkombola. You know those things, huh? There's a time when I was looking at the surgeon, the history of surgery, discovered that Africans are the ones who were very good at that. Okay, they understood.
Except we did not develop.
Yeah, except I don't, except it did not develop. Okay, and that is the truth. Except it did not develop. Oh, yes, brainwashed, correct. Yes.
Actually, in addition, that was the fourth born in the line of my mother's family, had a son, Dixon. They kept him with that, in local language we call it kalimba, their tongue tie, where somebody fails to produce words properly. He would be speaking as if he has got something hot in the mouth, where you can't even tell what he's saying. Or like the way he used to call the older sister, instead of calling her Sipo, he would call Hippo, something like that. So he couldn't produce the words. He was about, if I'm not mistaken, it could be between 7 and 8 years. That's when what they did, these people that is coding the African surgeon, what they came to inform my grandmother when the mother came visiting with the same children. So no, the one that is affecting this child is this tongue tie or akalim. This can be cut and the child will start speaking well. So there was debate in the family to say he's grown, he's what? Then they said, no, that African surgeon said, no, put everything on me. So what do we do? They said, since he's old, it will be difficult to cut him when he's normal. They made him drink beer. The boy was drunk, and then what they did, I still remember vividly what happened. He got take a small stick and put the razor blade in between to make it longer. And then they told one to say, hold the mouth so that it doesn't close quick before the operation is done. So the other one held his mouth, then the other one the tongue, and what he did, it's just a simple cut, just did once, like that. Then they let him. The child was drunk, but he woke up. I can assume that it is painful. It is painful. The moment he came, he started crying, and the words he started producing were no more words. Yes, everything was gone. You see, so I can attest to it to say at least they have that kind of African surgeon. I witnessed it; it worked. There was no other medicine involved apart from just the cutting it, because it's like this thing underneath here. It extends such that it comes closer to the teeth, that it holds the mouth. I mean the tongue down, so that the tongue cannot like vibrate the way it does to produce weight. Otherwise, that's a scenario that I witnessed. Thank you. Oh, okay. Brother Bernard says he had it. You can come and relate some. Oh, okay. Mm. Oh, so we have somebody who has it. So you didn't take like that one, right?
So according to, I don't know if you have answered it. Yes, you have an answer.
You can, for the sake of those that
Yes.
oh, he's saying having a tongue tie, is it not just some disability? That's what he's answering.
Yes.
As opposed to
So he's answering. He's telling you, saying it's some form of disability which can be corrected. There are a lot of disability, we are what they call defects. In short, he's saying defects. There are a lot of defects that we are born with, which can be corrected. Okay, you understand? Okay, one of it is the same tongue tie, because normal people, they do not have a tongue tie. But if you're born with a defect, they will correct the tongue tie. Understand? That's what he's answering. Other six finger, you understand? So those with six fingers, they would cut. Yeah. Are they? Or tie? They tie a string. Okay. So those are things. Verses says, huh? Because even this the one what we are learning also, there's again a defect that will be found here in the child. But when you check the umbilical cord, you check that the normal should have two arteries, one vein, the umbilical cord once it is cut. But others would have one vein, one artery. You see, these are defects that you find. So there are a lot of defects that they find, which the children are born. So you have to assess. Make sure also we didn't say we have to assess. Also, we have to assess the umbilical cord. Once the child is born, you have to again to assess the umbilical cord. Is it normal umbilical cord, or some parts have been left into the womb? You have to assess it. Okay.
Some parts remain here.
Mm.
Somebody always complaining. Yeah. So,
Yes, brother.
that point, where it says he complains how some being there, some parts of the what about those who are complaining or some?
Okay, well, those are kind of complaining of chamara. Machakati ma families, the mother. Those most of them that complain, it's like he might from passed on to the daughter to, it's called what? Inherited condition. Okay, so those who have inherited condition, the others that are specialized, African women that are specialized in doing that, in giving medicine. Okay, we had our land. I don't know the way she used to do. I have to, yes, landlady. I don't know how she specialized. I don't know because I haven't gotten that information.
Sorry for that interruption. We had some power cut. Thank you.
So I don't know that connection. What she does is that she first she'll make the child the person wanna chamala. We had there's another case. There's another one. With Sister Kasam, there's a certain what do you call woman. That is the daughter-in-law. So had that every time would not have a child or would have miscarriages. So until they said, I think Anacham Mala, then they went to do what they do. Then that person started delivering, can deliver babies now. So there are those that are very specialized in that. So one day we met with a certain woman, she explains, she would like give vinegar, eggs, and other things to make someone first clean, okay, purge. After that, then she would, I don't know, the four of some sort, she would come and insert her arm, I don't know, check the uterus. It's painful. I don't know what she does with the uterus, or I don't know what she checks, but she was taught to correct chamber that prevents. But in medical term, there are a lot of conditions, like I would call it endometriosis. Okay, endometriosis. Endometriosis is defined as some particles which are supposed to be grown, which are supposed to be in the uterus, they are growing outside the uterus. Okay, which can only be corrected at when a woman has what you call a child. When a woman is pregnant and delivers a child, that can be corrected. So those are the things that we find. And the dysmenorrhea, okay, dysmenorrhea conditions, most of them, they are corrected when a person has given birth. Any more questions and contributions? Okay. Not even a comprehensive man, but before, after just 2 weeks, 1 month, China and Indonesia, but from the time, I think that's what they send people to come back here after it is a fault. I'm sure that one. That's what. Yeah. So him is attesting, saying that I don't know if he has a wife, then or your sister. So he's attesting to that, saying the sister had dysmenorrhea or endometriosis or chamumala. Towards menses, you call it premenstrual syndrome, those or during menses, back pains, excruciating pain, headaches, and a lot of things. This sister had this, okay, until when she delivered, this thing went. So it's attesting, saying it's true. Other conditions, what do you call, if you requires you to have a child and you deliver. But others who've been taught that, imagine you have that, you go for medical help, and they tell you that you take it as mockery to what? Maybe again you're against being married. You don't want to have a child. And they tell you saying you need to have a child for this to be corrected. They leave saying, okay, I was insulted. That's what they take it. Okay. So basically but that is the truth. They tell you saying this can only be corrected when you have a child. So there are medicines that can suppress this. So others, it's like marjoram, marjoram, there's a spice called marjoram can correct this, and the other herbs can correct this. Like shatavari, the herbals that can help to alleviate, reduce this pain. But the best, the one that would end this complaint is childbirth. Any more questions? Doesn't. Okay.
I think there's something that I missed when you were giving the scenario of your landlady. I think that's about the time that power went. I didn't get exactly what you say she does to help out other than advising childbirth. So what else does
Saying she corrects. She specializes at helping those that do not give. What do you call? They are not fertile. Females that are not fertile.
Okay.
Okay. So what she does is that those that complain, so she will check for something. Most of them are Mala, so she will check. So she'll make someone purge first. So the method of purging, she doesn't give like any CC or purgative. The purgative, I don't know, she uses vinegar, eggs. So she'll make someone take vinegar mixed with egg, I don't know whatever she puts in there. Then we'll purge. After purging, then day 4 or day 3 of that process of purging, she'll now come, I don't know, she'll wear a glove and put something, then insert her, well, what do you call this? Fingers or fist. She inserts there and assesses the uterus. He assesses it. Okay. So if it's in a normal position, meaning what was wrong is not the woman. So there are particles that she checks. You check the uterus and again, if in the uterus it's just normal, then there are no those those things. Then she'll say, okay, maybe the man is the one that does the sperm count is less. So she will now concentrate on a man. She will know by that. So if she'll find those things which are there, she will know saying, okay, I think this the man is okay, and then she'll assess don't know whatever she has. That's the part which I'm saying. I don't know what, because if I get what she does, she assesses, then also I'll become an expert. But she doesn't. I don't know. I'm just saying.
But are you going to be no, the question is it going to be comfortable seeing the nakedness of other people?
So so what does a woman should learn
Yes,
from
Sister Banda is the one who should be able
to learn from her.
that.
To learn the art. So, but she's there. So if I try to explain it to a nurse or a midwife, they don't understand. They don't understand. The only part that I learned it from was Patty, the one who was teaching us midwifery. Patty Shipfield. This one, she was from America. I don't know if you know her. I hear that she's joined us now. Patty Shipfield. So she she was only mentioning because when she came, she's been called from what do you call, like in Africa also she would be called to do home deliveries. So, and she's trained many in this. She's training a lot of them in this to be doing home deliveries. So she was mentioning the part which we have to study also. I'll give an assignment of the immune system of the microvilli of the vagina, inside the vagina. Okay. So they say that once you insert in the sperm, you inject the sperm there, the immune system which is there it knows you. It will, but if it's a foreign, it will attack. It attacks the sperm. Okay, that part is there in science. It attacks, it reacts, it attacks the sperm. But if it knows you, it will not attack. That's the reason when you go to human papillomavirus and other conditions, is that a person will be prone to suffer from that. If you contracted the human papillomavirus from someone, then you go and have sexual intercourse with your wife, because the body's microbiota or bacteria in the vagina, they attack the foreign and the control. So if you bring, then they will not be able to attack. Okay, they know you. It's like me, I'm entering the state house. I'm one of them. I'm one of the OPs in the. So if I'm coming with someone who is a criminal, they will not guard us. They will not suspect or attack us, because I'm part of the system. So most of the invasion of the things, they happen because God created it in that way, and the system is familiar with that. So if you come with it, the system will not. Then other infections of females is using things that destroy that bacteria that acts as the immune defense. Soap, a lot of things, chlorine, and other things that would disturb the bacteria, the vaginal bacteria. Those are things that I learned from that. Okay. Any questions on that one? Yes, madam.
Biblically, I don't know if they realize scientifically. So biblically and science, this is about the government. This is about going to and that like waiting here, science. We don't know science future by somehow, somewhere.
Okay.
Contradiction in science in the Bible somehow. Like the reason we are having.
Okay. Let me give you homework you have to do. There's what you call, is it an answer that, or the lesson that you can learn from the Levitical Davidic Institute is a religion, one of the lessons. So there's a lesson that you have to understand what is religion. Okay. So in that one, it told you saying religion does not only concern Jesus, reading the Bible and other things. It tells you saying even agriculture is what? Is religion. Also eating is religion. Science is also religion. Understand? But in the importance of the same religion, discover that the fear of the Lord is the first in learning a religion. But you don't divorce. That's the reason I told you saying in the order of importance, science was to be learned number 4. Then number two, to answer your question again, is that in a ministry of healing or in a council, it tells you saying that true science does not separate you from God. So meaning there's science. Okay, that's the reason when you learn it in the entering wage, it tells you saying that entering wage, this message of health or this science message, it is what? It is as important as what? Yes. Is as what? The right hand is to the body. Okay. And it is connected to the third angel's message. It tells you as this. So you understood this one. Huh? So you can't divorce that. You can't divorce yourself from impregnating a what? A woman or your wife and have a child. Then you say that was not religion. Okay, Adventist home tells you saying in the bed chamber, angels are there. Yes. Okay. So in the bed chamber, angels are there and they're helping you. Okay, so that is religion in short, what we are saying. So these are inseparable. They are inseparable. Okay, that is in the manufacture room of God.
Okay, maybe so some other additional aspect is this, that he's saying that what we are learning is it religious or it is just science? What we are told is true science is dependent on God. If you look at the flowers, the way they will pollinate and everything they do in order to give themselves food and procreation, if it is not disturbed but studied, it helps us to understand what goes on in the plants, right? Would we call that religion or science? It is science that is religious. You understand? So also, when you are talking about the study that we have of midwifery, we find that the Bible says midwives should be female. What is midwife? Is to help give birth. So is that only for scientists or us? Like the point that Sister Olivia brought was that when the science saw that we, the people who are supposed to be teaching, are lazy and are not doing anything, science is taking up everything. I think this is the situation that we have. Even the White House report, pages 8, 9, and 10, bemoaning the state that because we, the ones who are supposed to do things, are not doing, the world has taken over that responsibility from off the shoulders of the what? The church. Are you seeing that? So you will never blame the scientist for your being lazy, as it were. So we see that if science exalts God, then it is true science. But if the scientists want to denounce God and think that they are better than God, then that is not true science. I think that's the demarcation, the line of demarcation, yes.
I think I passed something. The Bible like according to the course you gave us. I understand, but chase level, we don't go beyond that. We want just say which so which that do this, but this one. I think it's stages.
Okay, so you've done injustice to the people that are supposed to be following. How we are recording everything and we put it on YouTube. So what he's saying is appreciative of the lesson. Okay, it's more beneficial because we are getting the real life situations or things that we undergo. So if we happen to have this, he will be able to help out uh, to help out in this matter because he has knowledge and he wants this to continue. Just in basic in brief what you're saying. Okay, so yeah, so these are things that we're supposed to be learning because when you're studying the same religion in the answer, it tells you saying that a pastor should be knowledgeable in all. In all, because if he's not knowledgeable in all, he is stealing from the people. Yes, stealing. Yes, because a person he has also to be knowledgeable in knowing the ground, agriculture, to help the people. He has to be knowledgeable in all. Okay, basically that. So the Bible verses, Bible references are these in childbirth. Bible references. Okay. Timothy, 1 Timothy chapter 2, verse 15. It states as follows, says, notwithstanding, she shall be 1 Timothy chapter 2, verse 15. It says, notwithstanding, she shall be saved in childbearing. So it tells you saying that a woman will be saved in childbearing if they continue, Timothy, 1 Timothy chapter 2, verse 15, if they continue in faith and charity, that is, if they continue in faith, in religion, and love and holiness with the sobriety. Okay. She shall be saved in childbearing. Oh man. The other one, so meaning the significance in child what? Childbearing. Even the Bible recognizes this. Deuteronomy 28, verse 57 to 58, it says, and to what her young one that cometh out from between her feet, 28, verse 57 to 58. And toward her young one that cometh out from between her feet, and toward her children which she shall bear, for she shall eat them for want of all things. For she shall eat them for want of all things secretly in the siege and the straitness, wherewith thine enemy shall distress thee in thy gates. But if thou wilt not observe to do all the words of this law that are written in this book, that thou mayest fear this glorious and fearful name, the Lord thy God. So you've seen what will befall. These are cases in Deuteronomy 28 to what will befall the children of God. So the case that will befall is that we'll end up eating each other, right? It is called cannibal what? If we, yes, if we don't respect the laws of God, okay, which is what we're in. We're in this where we're taken into all parts of the nations, okay, as slaves. And because of that, there's even a time when we're eating each other. This was a prediction, okay. But
actually, this one came to pass when the children of Israel were surrounded. Was it by the Romans? The Romans? Yes, the Romans. Pardon? Yes, when they were surrounded by the Romans. There was a time that I'm not, because I want to be true on that one. There was a time we were surrounded by the Syrians. There was a time they were surrounded by the Romans. So I'm not so sure between the two scenarios that the one I'm trying to bring across happened. So it so happened that the king did not know that women started agreeing to say, because there's too much hunger, let us eat your child. And then tomorrow we eat yours. So they killed the child of their friend, cooked, ate, and then the turn for that other woman to do the same came. She refused. So they started quarreling until the matter reached the king to say, this is what has happened. And the king rent his robes, you remember? Say, the people have reached to this extent of eating one another. So now that's why I'm saying I wanted to relate, because that's about the time that the prophet went and told the king to say, tomorrow by this time, food will be plenty and a barrel of what will be this. Is it? It should, yeah. So it should be, then it must be the Syrians, right? Yes, it was the Syrians at that time that's a scenario that I'm trying to relate. So we see that it fulfilled what God was telling them here. That normally we are given the childbirth to be as a source of procreation, not as a source of food. So when our children become our food, we should know that we have sinned greatly against the Lord. That is what the case is all about. So we see that childbearing is a blessing, but that blessing, if we sin, may turn out to be a what? A case. Thank you.
okay. Another quote is John 16 verse 21. John 16 verse 21. It says, a woman when she is in a travel has a sorrow. That is when she's giving birth, because her hour is come. But as soon as she is delivered of the child, she remembereth no more the anguish for joy that a man is born into the world. You understood this quote?
Is that true, Mrs. Banda? Oh, thank you.
You're reading also? What were you saying? Okay. So here it says that a woman, when she is in labor, has a sorrow. We see they can get anything, they can cry, they can be wangambotukana, they are in sorrow, right? Angombotukana wana mpasa mimba, wanivutisa. Tukana nurse, yes. After that, because her hour is come, but as soon as she is delivered of the child, she remembers no more the anguish for joy that a man is born into the world. She forgets everything. She forgets the pain. She forgets everything. Okay. But during that process, I will never have a child again. Never. But after this, They will forget. They will have a child. They say, "How can I have?"
By the time they want to remember the neighbor, they would have 10 children.
Yes. Okay. Genesis 35, verse 16 to 17. Genesis 35, verse 16 to 17. And they journeyed from Bethel, and there was but a little way to come to Ephrath. Okay. And Rachel traveled, and she had labor. And it came to pass, when she was in hard labor, that the midwife said unto her, Fear not, thou shalt have this son also. Remember this, huh? This was the birth of who? Huh? Benjamin, huh? Okay. This one died at this birth, huh? Rachel. Okay. She died. She had hard labor. So it was paining. So we see that there's also midwives, the midwives in the Bible. Genesis 38, verse 27 to 28. I know discussions on the cause of Rachel's death. I don't know, but I think it was. I don't know what you believe on Rachel's death. Is because of delivery that the cause of her death, or it was because she was cursed by Jacob? Huh? The cause of the death of this woman, Rachel, was it because of delivery, or because she was cursed by Jacob? Because with me, I think that what caused the death of Rachel was because of the case of Jacob. Because remember, Jacob unknowingly cursed Rachel. When Laban followed, when Rachel stole something from the father, then followed Jacob with his armies, then said, "You have stolen something from me." Then Jacob did not know anything. Then he says, if we have stolen something, let that person what? He decreed some casing on the person who was stolen. Yes. Then it happened that the person who stole was his beloved wife. Yes. And the death decrees that he did case the what? It befell on Rachel.
So which means after the death of Rachel, Jacob remained there, all the other children.
Hello?
They remained there after the death of Rachel.
Yes, yes. Jacob had two concubines and two wives. So when Rachel died, meaning he had one wife, two concubines. Yes. So meaning all the children, they were with who? With the wife. And remember that again, there's another of the two concubines, there's another one that cheated him. Right? Slept with the Reuben, the firstborn of the concubines.
And there,
No, I don't know. There's no story of the son, but we know that they cheated, yeah?
Yeah.
So maybe the part that you are talking about Laban and Jacob with the cases. This is Genesis chapter 31, we can start reading from verse 34. This is just in the middle of it, but Laban had complained that Jacob had stolen his idol god, his images. Okay, so verse 34 says, now Rachel had taken the images and put them in the camel's furniture and sat upon them. And Laban searched all the tent, but found them not. And she said to her father, let it not displease my lord that I cannot rise up before thee. For the custom of a woman is upon me. And he searched, but found not the images. So she was pregnant when she had stolen that. And she was saying that, oh, Father, I should have saluted you by standing up in your presence. But now, because I'm up, I can't do that. So the truth was, she was seated where the things that the father was looking for were. Okay? And then verse 36 now is where Brother Keagan says, and then says, and Jacob was wroth and chode with Laban, and Jacob answered and said to Laban, what is my trespass? What is my sin that thou hast so hotly pursued after me? Whereas thou hast searched all my stuff, what hast thou found, O of thy household stuff? Set it here before my brethren and thy brethren, that they may judge betwixt us. These 20 years have I been with thee. Thy ewes and thy she goats have not cast their young. Okay, let me see where he comes to case him. Oh, no, it's actually up, right? So, verse 32, with whomsoever findeth thy God, let him not live. Yeah, so Genesis 31, verse 32, yes. So that is the case. So that's why, as Brother Keagan has said, that's why Rachel died after giving birth. She is saying, with whomsoever thou findest thy God, let him not live. Before our brethren descend, thou what is thine with me, and take it to thee. For Jacob knew not that Rachel had stolen. So the cause of death for Rachel was that she stole her father's images or idols.
Okay. They've seen, huh? That's what caused the death. That's what I believe caused the death of Rachel. So we should not be casing anyhow.
Quick to case.
Yes, we should not be quick to case. Yes, you can case even children. Your children that you have, you case them to materialize. Yes.
Many a time that's what happens. We go out to the limbo,
what? Then it happens. Like there's a certain story, I don't know, I was listening it from the what, where a woman wanted to have what again I witnessed it from our neighbor. There's a certain friend of ours, is our neighbor. Then apala chevana bakazi beka. Then and afunu nkala na mwana, he tries to have a child, he bears just female children. Then he tries now, okay, I want to have a male child. Then he discovers when he goes to the hospital, he discovers that it's the woman is given birth to a female child again. He begins to insult the nurses. Then he goes there. So what happens is that the story that I want to narrate is this: that if a woman she has a wish, she desires that to have a a male child, then this child is it happens that it's a female child. Okay, because the emotions of the person who is carrying a child and also the husband, they are transmitted to the unborn child, to this child. So she'll be affected. This story happens that there's a certain story where a woman a woman gave birth to a male child, but she was wishing for this child to be a female child. Okay, she was not happy. She was wishing every time she would resent the child because she did not give birth to the child that she wanted. Then the child ended up to be what we call today as the what? No, those that are lesbians and what? Yes, gay. They become gay. Yes, those things. Those are the things I think I learned from that. Maybe that's the reason to why a lot of people are wishing. They've even gone to the extent of changing their biological makeup. They've gone beyond because of the things that we do. We desire because a child will know they wish since they belong to this mother and they know truly that the mother didn't want me to be the way I am. It will haunt them for the rest of their lives. There's another one that I saw. It's a especially the psychologists are the ones that can understand this. There's another one where this one was a surgeon, a neurosurgeon. So wanted to give birth to a what? If give birth to a male, but ended up giving birth had a child who was a female. Okay, and this child learned that the father wanted to have a male. So, and the way the behavior, so the father had another another woman again tried to have a child, then they had still more a female child. But the favor was the father was favoring more of that other child because this child was cute and beautiful. Would get the dolls from this child and give. And this child was noticing, saying, my father gets my dolls. Because once you give a present, a doll to your child, the child will treasure this doll, or even know the doll, okay, and be playing with the doll. So got that doll and gave it to another child. So she noticed that. So when she was growing up and she learned the same skill or profession of the father was a neurosurgeon because she did the same course. So she became, those psychopaths. She started now at, what do you call, kidnapping beautiful young girls and making them into dolls. Okay, that's what she started doing. Kidnapping because of the same effect that was left by the father. It traumatized her. It left the effect in her brain, significant effects. What was causing her to do that? It was because of that voidness which was happening in her. So we should try to avoid all that. The wish, because what will cause someone to become a junk, to be killing people, or to be behaving the way they are behaving today, is the way we treat them. So what corrected that was when they caught this one, they brought the exact dough that was corrected, given to another child. Then they presented to her. That's when she stopped doing that. The neurosurgeons, they can catch a beautiful girl, then they manipulate the names. They are just names. If you started the names, you can make someone, you can just manipulate the names, then the person cannot be moving. It will just become like this. So she would play with them. She just manipulate the names, and they are there. She makes them dolls. That's what she used to do. Yes. Okay, so those are the stories that you have to to know from this story? Very serious one. Yes, man. Umbilical cord.
Umbilical cord. Nazombera kwa lugha hakuna program ya instead of practice ngene mlokuru basi ngene mbona tukapata basi lifestyle na zola support the movement walipokuwa kile kwa cause usoma ile. So those people like grab mtomo kama mnatika ndipo mali madeki hapa. Does it contribute to bring out mwana ngalabu alikuwa na funga na funga. Well, the same issue of catching the umbilical before kabla kama tuwa kabla ya separated.
Okay, so he's asking a question, says the sudden cutting of the umbilical cord or clamping of the umbilical cord, does it contribute to today's junkies? Like, today's junkies or mental conditions? Yes, the mental conditions, because there are a lot of factors to why we have mental conditions. Also, we can attribute it to the mental, talking of the mental, okay, mental. So also can be the factor, but it's not the only factor, because today's we don't breastfeed our children. We learned of omega-3 that is found in breast milk versus the omega-3 that is found in cow's milk. So what causes the development of the child is breast milk, the omega-3 that comes from breast milk. Okay, so a lot of people, they don't breastfeed their children due to work and the environmental demands today, or modern demands. And also the same thing that you've mentioned is one of the contributing factor, but not entirely the contributing factor. Okay, I hope I've answered your question.
Yeah, maybe just an addition to these junkies that we have around. Some people were thinking that junkies are only found in shanty compounds, but we discovered that they are almost everywhere now. And if you take a survey, like he has given of maybe the kind of food that babies are given, most of us that are especially grown and born in the cities, we are the worst culprits in as far as those things are concerned. You go to the rural places, you never find the number of junkies that you find in town. Okay, I'll break down some of the aspects in relation to what Keagan has given, but just give it more like details. A child is born at 3 months. Instant milk porridge is introduced. What is added? Cow milk. And then you see the baby is growing, baby bounce boy, what? And the pictures with today's Facebook, we show this baby is growing very fast. Unknown to us that actually we're doing injustice to the baby. We are feeding him the milk that should be able to help the cow to walk faster and to develop its limbs, to a baby that he actually needs to develop his brain, his heart, everything right. So you have instant porridges that are made and given to the child. They even tell you at 3 months you start giving, at this month you start giving. Then when you look at all those cereals that are involved in there, most of them, beloved, they lack the proper nutrients that they talk about. What do they do to supply the lack? They make manufactured ones, isn't it? Yes. So now, if you are calling a junkie for all those things, you also call those that go to Hungry Lion to say they are eating junky foods. Why are they not also called junkies? Is it because they spend more money at a Hungry Lion? What they are buying is junky food. You see? So I was just trying to answer your question to say, junkie is in the form of what we are eating. And how many have we discouraged? Inspiration discourages us from eating such foods, right? So we see that actually the biggest culprit in the mass production of junkies is the food we eat. So the human propensities and their abilities to subsist on the natural food is destroyed from infancy. So the cravings for any, because me, I'm shocked when I look at what these people now can do. They go to the geyser, they say there's a powder in there. When they smoke that one, within a few seconds, somebody's gone. You find that ibimalenda chevichoka at is high. They go, so they go to you are sick. You are told, say, oh, Benlin, you take a tablespoon or a teaspoon, your cough will go. Then they read, they find that, oh, there's opium. They drink the whole bottle and then they are high. You see, this Benlin and codeine, they are just normal drugs that they were helping people to relieve cough. But what our brothers and sisters are doing is they drink everything at a go and then they are high. You see? And so you call them junkies, but what has made them a junkie? It is an overdose. An overdose of what? A prescribed thing that you created to say it relieves pain, right? So somebody overdoes it. So basically, junkies, my brother, are produced not because they are born like that, but we create them through the food stuff that we are consuming. Yes, yeah, Sister Banda says even the environment. Yeah, thank you. I thought of adding that, brother. Okay.
Okay. So you've heard, huh? So there are a lot of factors, a lot of them. Environmental question and the foods that we subject ourselves to eat or to give our children.
They will look like it's the uncle and niece. They are the same things.
Genesis 38 verse, yes. Okay.
That's by saying that.
What causes most, maybe even during when the mother is pregnant. What I've just reading from citing 217. That the well-being of the child will be affected by the habits of the mother. Her appetites and passions are to be controlled by the principle. There is something for her to shun, something for her to work against, if she fulfills God's purposes for her in giving her a child. If before birth of her child she is self-indulgent, if she is selfish, impatient, and exacting, these traits will be reflected in the disposition of the child. Thus many children have received as a birthright, almost unquestionable tenderness, evil. But if the mother unswervingly adheres to the right principles, if she is temperate and self-denying, if she is kind, gentle, and unselfish, she may give her child these same precious traits of character. Very explicitly was the command prohibiting the use of wine by the mother. Every drop of strong drink taken by her to gratify appetite endangers the physical, mental, and more healthy of our child and is as a direct sin against our creator. So what we find is, what really the pregnant woman takes, that's what the child takes who is in the stomach. It's not so. So if the mother is in the womb, if the mother is drinking alcohol, definitely the possibility of the child taking out alcohol would be high. Even the food what she eats during that pregnancy. The same. So we just have to control our appetite, even as mothers, as they eat, and even us as parents as well, so that we can even produce good children in the society.
Okay, so that's the reason we'll go. The next lesson after this, we're going to look at breastfeeding and lactation. First, in the breastfeeding and lactation, we're going to look at the food of the mother, the food that the child should be eating, breastfeeding. Okay, in that by counsel, what Ellen White she spoke about this. So that quote tells you saying the sources of also the contributing factor of the junkie also is to do with the mother as well, or the parents, the mother, the food that she eats. If she was eating junky foods, the child also will be eating junky foods. There is no bad child, but bad parenting or poor parenting. Okay, then you say, chimwana cha komando waza mubasa man. So those are the things.
Yeah, like most of these women, you find that they would be complaining, each one chikonda vo pempa vo lilila. But when you were also pregnant, you started craving wrong things altogether. So the baby was copying. And yeah, you find that the baby always wants whatever the friend, even if it doesn't make sense for as long as it is with a friend, the baby will cry for it. This is basically who we are when we are doing that. Actually, this brings me back to the same story we are talking about of Genesis concerning Jacob and his wives, and also his lifestyle in Laban's home. He learned the art of how to multiply animals with the strips. You see, you have animals which have natural colors, but they give birth to like a dangwaleza, a mwavi kind of creatures. What did he do? He just painted the strips, and he made sure that the animals, when they are mating, they look at that. So the concentration and the energies the animals have while looking at that affected even their genetic makeup. Isn't it, Keagan? You see? So these things are very serious. He talked of you want a female, what? Even if the both of you don't agree, this other one mind, I want a female, this other one male. You end up having people that have transgender now. A child is confused. He doesn't know whether she's male or female. And then you start wondering, what happened? The mother is normal. I am normal. No, your thoughts. Yes. Maybe these are transmitted. If Jacob can be able to learn that art and it happened with animals in real life, that you have two black animals, they produce a different color altogether. I mean, all he did was a trick to say when he knew that it's time to mate, let me take them there. They are looking at that, then Laban comes, this is a wrong color, take it. He finds that the whole field now is filled with wrong colored animals. And the man becomes rich instantly. You see? So, when we say have intimacy with your wife, let your minds be together. Agree on the right principles, then you have no problem. So we can be troubling the doctors to start researching what is causing our children to be transgender, to be homosexuals, when actually the real culprits, it is us parents. You see? Thank you.
Yeah. So the other biblical verses, Bible verses, is Genesis 38, verse 27 to 28. This one is talking of, I think, Tamar. Genesis 38, verse 27 to 28. Says, and it came to pass in the time of her travel that behold, twins were in her womb. in our womb. And it came to pass when she traveled that the one put out his hand, and the midwife took and bound upon his hand a scarlet thread, saying, "This came out first." You remember the story? Perez and Zara. Huh? Okay. So this is talking of Tamar. These are children of Judah. Okay, so all this, when you check in the Bible, we had midwives. Midwives were females. This is the example of a breach. Exodus 1 verse 15 to 21. Exodus 1 verse 15 to 21. It says, "And the king of Egypt spake to the Hebrew midwives, of which the name of the one was the Shipra, and the name of the other Pua." These questions they come. Says, can you mention the name, one of the names of the Egyptian midwives? Okay. Yes, it does come. They don't study the Bible. We don't even know that the Egyptian midwives, they were actually midwives. Yes, why? Exodus 1 verse 15 to 21. Okay, and he said, when he do the office of a midwife to the Hebrew women, and see them upon the stool, if it be a son, then he shall kill him. But if it be a daughter, then she shall live. That is Pharaoh told them, saying that you should kill the Hebrew male children. Okay. Then what happened is that these midwives, but the midwives, that is verse 17, but the midwives feared God and did not, as the king of Egypt commanded them, but saved the men children alive. Saved the men children alive. Okay. And the king of Egypt called for the midwives and said unto them, why have ye done this thing and have saved the men children alive? And the midwives said unto Pharaoh, because the Hebrew women are not as the Egyptian women, for they are lively and are delivered ere the midwives come in unto them. Have you understood this phrase? Huh? And are delivered. Yes. Yeah. So they knew the food or the herbs they were taking, because this one they would deliver fast compared to the Egyptians. They are not like the Egyptian women. These they would deliver fast. Therefore, God dealt.
Okay, so sorry for that interruption. Okay.
Okay, so there are many. There's another one. This other one is Jeremiah 20 verse 18, which says, wherefore came I forth out of the womb to see labor and sorrow, that my days should be consumed with shame. And the other one is Jeremiah 4 verse 31. Okay, so there are many more. So there are many here. Let me just give you, then I'll not read them. Discover that here there are many more verses of childbirth in the Bible. Okay. Keagan India. Also Psalms, Psalms what? Psalms 22. Psalms 22 verse 9 to 10. Isaiah 26 verse 17 to 18. Okay, that was the last one. Okay, so I end here for this lesson. So we've taken a lot, huh? We've talked a lot. we've discussed. So far, I hope a lot of people have gone with the points of midwife. They have ideas of midwives. I hope so. So I end here the period.
I don't know if there's any other question, comment, or contributions. Okay, if there's none, Brother John Shapanda, you're going to close for us in prayer. You'll pray also for the food, as the rest of us will kneel down.
Our God and our Father, bow to you. Jehovah, come before you through the name of our Lord Jesus Christ. We've come to a break for lunch. You've been with us from morning to this time. Jehovah, as we are looking forward to have many more lessons, we pray that may your blessings and your Holy Spirit be with us and continue to be with us and help us and guide us in any step we want to take. On our own, we are nothing, but we leave everything in the hand of our Lord Jesus Christ. Let your will be done upon us. As we are looking forward to having the lunch, we pray also for the food. May you bless the food we are going to partake and help those who don't have. We pray and asking through the name of our Lord Jesus Christ. We leave everything and our prayer. Amen.
Okay, so this is where we end our morning session. We'll meet in the afternoon at 14:30 for another Bible study entitled The Two Covenants by Brother Bernard Chibwana.